Okay, guys, get your computers ready. We'll take this quiz real quick. It is all capital letters, POC.
So everybody's done, correct? Okay, so let's get started. Let's go through the questions again, just to kind of view what we did for our answers. So the number that we use for cataloging is the Assessment number. According to the CLSI, the maximum time that can be allotted and elapsed between collection of blood sample and separation of cells from plasma or serum is that 2 hours. Before dividing the 24-hour urine sample, you must measure and record the volume of the sample. Blood smears from the EDTA specimens must be made within an hour after collection to prevent distortion of the cells. How many times should tubes with additives be inverted? It's 5 to 10. The phlebotomist had difficulty filling 2 different bottles. What should she do? He or she should reject at the bedside and redraw. The metabolic breakdown of sugar within cells, glycolysis. A consent form is required to perform HIV testing. According to the CLIA, what is the classification of tests that are simple and can be done like at the bedside? That's called a waived level. There was a question about some blood levels of an analyte that increases in congestive heart failure. That was the BNP. What's another name for the POCT? And it's called alternate site testing. The most common chemistry test performed via POCT is the glucose testing. What type of sample is used for occult blood testing? And that's feces. The bacteria found in the stomach is H. pylori. Which of the following POCT is used to screen for colon cancer or gastric ulcers? And that's occult blood. The FDA is the agency that decides whether a given test is the CLIA waived test. And then you did the lab order, which was yellow, light blue, glass red, red, gray tube, or gold, green, lavender, and gray. All right. So let's move on, guys. Oh, before I will forget this. So let's do this now. Send me an email with your schedules. I have an opportunity for you guys to do a clinical rotation at Parkersburg Cardiology. So I need to see outside of Fridays if there are any other days that each of you are available. This is going to be I think a really great opportunity, not only for your EKG rotation. What a better place to go than a cardiology facility. But they are also looking for people to hire and have already asked me for recommendations between the 4 of you. So there's an opportunity here, guys, that you could actually be, they're looking for PCT, but they love the idea that you guys also are getting the phlebotomy and the EKG technicians. So they are also looking for EKG technicians. So this might be a great opportunity for someone out there who would want to work in that kind of facility. So send me an email here as soon as you can, sometime today, hopefully, about your schedules and your school work, et cetera, and what times you would be available, so that I can get with the CEO there and get you guys scheduled in for that. Okay, so let's get moving. right. Let's start with a little humor today. All right, so I do want you to grab a piece of paper if you have it and a pencil, and I want you to try to find as many errors as you can and jot them down as we go through this. Are we ready?
Miss Grit, whatever. Come get some blood from you.
I'm right next to you, Rona.
Be right back. I told you I'd be right back.
Ew.
Hey, yeah. You still be. Hold on. Wait a minute. Wait. Hold it right there for me. Look what you've done. I told you to be still and hold this. Goodness gracious. Tell you. Can't do nothing right. Oh, well, it's almost time for me to go anyway. Somebody come and clean it up.
Okay, so let's put your unmutes on for me. Let's before we go through it. What do you guys give me some things that you saw were wrong?
There's so many.
Huh?
I said there's so many.
I know. Isn't that awful? Oh,
Yeah.
that was pretty bad. So give me a couple of things. Let's start right at the beginning. When
She didn't knock and introduce herself and say that she was coming in. She just kind of went in.
Yeah. Did she check the ID? Really?
No.
No. This is pretty bad. Right. So she didn't really check the ID. How long did she leave that tourniquet on?
A very long time.
Oh, yeah. Very long.
I do believe she also dropped the syringe. I'm not sure, but I think I saw that.
Mm-hmm.
She started digging around in there.
Oh, when the patient like flinched or something, she didn't ask her what was wrong. She just told her to quit moving.
Right. She didn't even tell her what she was going to do, like you guys said. She turned her back. Go ahead.
She stuck the thing in her mouth to hold it.
Yeah. Yeah. That was gross. I believe she may have even stuck the needle after she drew it into the mattress there for a while before then she turned her back and labeled and yes, and she wasn't very nice, was she?
Told the patient to hold the gauze.
Yeah.
Yeah.
Yeah. No gloves. Yeah, no gloves. Yeah, there was just so much wrong. All right, we came up with them, so I'm glad you guys saw that. Let's see what they think. Oh gosh, I didn't even see that. She was eating out of her pocket. There you go, Sam. You were right. Did she wash her hands?
Grit. Whatever. Come get some blood from you.
What in the wide world of sports is going on here?
Yeah, didn't wash her hands.
Be right back. I told you I'd be right back.
This is developing into a very bad habit.
Yeah, how about that we?
And with no more brains than you have, but they have one thing you haven't got, a diploma.
Yeah. You still be, hold on, wait a minute, wait.
What we've got here is failure to communicate.
Oh, she's touching the needle. Yeah.
Hold it right there for me.
So the tourniquet's still on.
Code red, repeat. We are at code red. Looks like I picked the wrong week to quit amphetamines.
Look what you've done. I told you to be sitting, hold this. Tell you. Can't do nothing right.
Boo-hoo.
Oh, well, it's almost time for me to go anyway. Somebody come and clean it up.
Surely you can't be serious. I finish work. I go home.
All right, that was a little fun. So you guys were very good at pulling out those issues. Let's just do one more and we'll move on. Okay.
Does your phlebotomy tray or outpatient area look this sloppy? If so, the patient is entitled to think your technique is sloppy too, and so is that of the laboratory. Take a look at your outpatient area and your phlebotomy trays through the eyes of a patient. What do you see? Are they neat and tidy? Well, then it looks like you're organized and that you have high standards. In no setting is it more important to project a positive image than it is in healthcare. But I would caution you, don't be so obsessed with looking organized that you pre-assemble your blood collection devices in advance of the patient arriving to your station, or in advance of you arriving to the patient's bedside. Patients want to have that confidence of seeing you assemble those devices in their presence. Look, you're only going to save a couple seconds, so instead, let that patient see you assemble those devices from the sterile environments of their packaging. Let them see that you've assembled it fresh. As long as you're pre-assembling your devices before you get to the patient's side, there's always going to be that potential for the patient to be fearful of the care they received. So make sure you give that patient the confidence that they need and assemble your devices in their presence, and eradicate the potential for them to go away thinking that they might have just been drawn by a leftover needle from the last patient. What image does this present to the patient? What does it say to the patient when they see something like this? In your outpatient draw stations, if it creates a negative impression, eliminate it. What kind of impression does this present to the patient who walks in for lab work? It's not very flattering, is it? Take a look at your outpatient areas through the eyes of a patient and eliminate those things that you wouldn't like to see if you were the patient.
All right. So we went from crazy woman to keeping things organized. Okay, let's start, guys. We're going to go on to chapter 18 today. All right. So we're going to talk about, and this is not fun to talk about, but we'll just try to get through this as painless as that we can. Quality control. Okay, so let's just review what that means. Quality phlebotomy refers to sets of policies and procedures so that we give the highest quality of care to our patients and that we have consistent specimen analysis. Okay, so we want to make sure there's no errors. We want to reduce as many errors as possible, and that's through getting the lab and then getting it to the lab on time in the right order and et cetera. So quality control, or QC, it refers to the quantitative methods used to monitor the quality procedures, such as things as regular inspections and calibrating, like your glucose monitor, for instance. That's quality control. Its quality control is part of what's called quality assurance. So that's kind of the larger set of methods used to guarantee quality patient care. This is including methods used for patient prep and collection and transportation. So the protocols. So you've got quality control where you're doing your calibrations on your test or on your glucose monitors. And then you've got this bigger picture, which is quality assurance, that's trying to assure and set up protocols for lab draws, transportation, et cetera. Both QC and QA are included in what's called total quality management, TQM. So that is the entire set of approaches used by an institution to provide patient satisfaction, okay? Continuous quality improvement is the major goal of the TQM programs. Does that all make sense a little bit? I know it's a lot. All right. So let's try to see if we can figure this out with this. Okay. Oops. Let's see here what's happening. Oh, all right. Let me try something real quick. Fix this. All right. So what do you guys think this is? Go ahead and chat me. A larger set of methods used to guarantee quality patient care, including the patient prep, specimen collection, and how you transport it. Which one of those little letters? All right, let's see what it is. So it's quality assurance. Very good, guys. Quality assurance. All right, so quality assurance programs, they're mandated by the Joint Commission, okay? So the Joint Commission standards require that there's some kind of systemic progress that's in place to evaluate patient care. So we want quality patient care at all times. So the Joint Commission kind of mandates a lot in hospital settings, especially. So they are mandated by Joint Commissions that all facilities have those. Of course, we just did that. Which one of these mandate quality assurance? Okay, so the Joint Commission mandates quality assurance programs. All right, so this total quality management, what is it? It focuses on gradual, continual improvements in the quality of services provided by the lab. Rather than setting a minimum standard to be met, the total quality management program or philosophy sees the potential for improvement in every area. No matter how high your current performance is, they want to improve the services at all times, okay? Quality assurance guarantees quality patient care, both technical and non-technical procedures. Quality programs use written documentation to set standards. In the event of a problem, documentation provides us a means of monitoring the actions so that we can resolve any kind of problem. Quality control is part of quality assurance. Together, they again will ensure quality patient care. Quality control. So quality control requires documenting equipment inspections, calibrations that you've done on instruments, and monitoring protocols used in each step of phlebotomy, okay? So it is the checks and balances per se. Also, on every unit, there should be a procedure manual. Like in the lab, there will be a procedure manual. It should be a procedure manual in all departments, and they contain all the protocols and information about tests being performed in the lab, including the principle behind the test. Why are you doing the test? Okay, the purpose of performing it, the specimen type that it requires, how you collect it, and any equipment that you need. Okay. Quality assurance procedures relevant to the procedure manual, including updated standards and protocols. So this manual will have everything that you need to know on all those lab that you're going to draw, more or less. There's a directory of service, and it contains a variety of information that's pertinent to smooth coordination of nursing staff and the lab staff. It includes laboratory test schedules, early morning collection schedules, written notifications of any changes, information on patient prep, specimen types, how you handle it, the turnaround, how fast you need to get to the lab, and normal values, okay? It can be online or it could be hard copy on the unit. All right, so this question's asking you, laboratory document that contains information about the principles underlying testing and other protocols is. All right, let's see if it is. Got one more. All right, I think you guys were unanimous. Procedure manual. Good. Document containing information about laboratory schedules, patient prep, and specimen handling is called. Directory of services. So they're going to contain lab schedules, patient prep, and any specimen handling. All right, here we go. So you do need to know some of this. First of all, we're going to talk about variables. So variables are any factor that can be measured or counted that affects the outcome of that test. Okay, so variable is essentially anything that can interfere or that can be measured or counted that affects the outcome of the test. Then there's pre-analytic variable, and this occurs, of course, occurs before the specimen is analyzed. Okay. Analytic variables occur during specimen analysis. And it can be affected by what happens before you take the test or pre-analytic, such as like the collection time or the way it was transported. These all can affect the testing process, okay? So you've got a variable, which means anything that can be measured or counted that affects the test outcome. The pre-analytic it occurs before the analysis of the specimen. The analytic variable occurs during specimen analysis, and this could be pre-analytic, like I said, collection time. Did you actually put it in the ice slurry? Anything that affects the testing process. Then you've got the post-analytic. So delays in reporting and following up on the test. Maybe somebody improperly entered the results in the data bank, okay? So these are things that are happening after. That also may be part of your responsibility depending on where you work. So if your job is also to put in results, then that might be your monitoring of the variable is performed and documented to ensure that its impact on the test is minimized. So we need to make sure that everything, all the I's are dotted, T's are crossed, kind of thing. So the one that you guys are most involved in and most responsible for controlling is what's called the pre-analytic variable, okay? And have the least control over prep. So you have the most control over the pre-analytic variable, but you have the least control over the patient prep. So you have no control if that person fasted for 8 hours before getting his fasting blood sugar. So you have the least control of what the patient did before they got there, right? But you have the most control of what's called the pre-analytic. All right, so variables to be controlled include duplicate or missing requisitions, okay? So the machine or somehow there's been 2 requisitions for the same thing. So that's a variable that can be controlled. Tests left off the requisition, so not all the tests were put on your slip. The missing patient number, the missing doctor name, or priority not indicated. So if it was a stat draw and you took it and an hour later it gets to the lab, that's something that could have been controlled. QA procedures for these variables include recording and counting the numbers of each type of requisition errors. So pre-analytic, let's talk a little bit about that because that's where you guys are more concerned. So pre-analytic variables occur in each area of the phlebotomist's duty, beginning with the test ordering and the requisition handling. Requisitions must be accurate and completely filled out with the patient number, test ordered, and the priority, okay? Like I gave you that example of me having the COVID test and it was sent down to the lab with no name on it. So they had to redo it. Not fun. When demographic or diagnostic and insurance information is omitted or is inaccurate, there's a delay in the reporting, okay? Which introduces a post-analytic variable. All right, so answer this question for me. This occurs during a specimen analysis, can be affected by the pre, such as the collection time or the transporting. Which one is this one? Let's see. It's the analytic variable, okay? So occurs during specimen analysis, and it can be affected by what you've done before, like transporting and the collection time. Which one are you guys most responsible for? All right, let's see what you said. So you guys are going to be most responsible for the pre-analytic. All right, equipment. So phlebotomy equipment is designed and manufactured to be free of defects. Okay, so this minimizes the variable, but errors do occur. Phlebotomists, it's up to you guys really to identify and eliminate any kind of thing that's going wrong with your equipment. Okay, so your tubes should be checked for expiration dates, cracks, things like that. You're never going to use a defective needle or one from a package with a broken seal or one that was dropped on the floor, right? Stoppers should be checked for cracks or improper sealing. Tubes may lose their vacuum without any visible sign of defect. Needles should always be checked for defects, okay? So here's what I said about expired tubes. Tubes need to be checked for the lot number and the expiration date. Never use that expired tube. It may lose vacuum without any visible sign of defect. So if you look at that tube and there's nothing, you don't see anything wrong with it, but it doesn't have any vacuum, it could be just an expired tube, okay? When filling a tube, be aware of the incomplete filling because of the loss of vacuum. So if it's filling and all of a sudden it stops, it could be just the tube. All right. Patient identification. It strongly emphasizes at the top there that proper patient identification is probably the most important procedure in phlebotomy. Like we saw in that video, she didn't even ask or check the ID bracelet or anything. She just said it. She couldn't even pronounce the person's name. So we got to make sure we do that. A Delta check is a QA procedure that helps spot identifying or identification errors, okay? Proper identification is made when the patient number on the requisition form matches the number on the patient's identification bracelet, and that band is attached to the patient. So you come in and they can't stand that band and they put it on their nightstand next to them. You need to make sure that the nurse comes in and puts a new one on them. The Delta check compares previous patient results with current results also. If the difference delta between the two sets of results is outside the limit of an expected variation, it alerts the lab, okay? Personnel to possible errors. So what does that mean? All right, so first of all, let's go here. Improper identification of the patient is considered what type of variable? Good. So it's pre-analytic, right? Something we've done before. We've taken the lab. Patient prep. So the patient's physical condition is significant and it can affect the sample quality. The phlebotomist has little or no control over most of these variables, like I said. So if they were supposed to fast and they didn't fast, that's not something that you had control over, okay? Things that we can control, though, are like posture. A sample collected from a person sitting up has higher concentrations of large molecules such as enzymes and albumin, as well as white blood cells and red blood cells, compared with samples collected for somebody lying down, okay? So another thing that can affect is exercise. So somebody went running that morning and then came in to get their lab. It can alter the results of the test. It can actually alter things like creatine, white blood cells, fatty acids, etc. Muscle enzymes. All right, a blood sample. Let's see if I can move this thing down. It's in my way. Okay, so a blood sample from a patient who is standing up will have higher levels of what analyte compared to samples from a person lying down? Which one? You remember? Let's see. Albumin. So albumin levels will be altered. It will be higher if they're standing up, okay? Okay, long-term exercise. Like I said, a prolonged exercise regimen increases things like sex hormones, as well as many of the values increased by short-term exercise. Medications and medical treatments, things like aspirin, can make prolonged bleeding times. If somebody is getting other treatments, like they've had some kind of radiographic dye, blood transfusion, IV fluids, that might also affect the results. Somebody who's on things like Coumadin, warfarin, heparin can cause prolonged breathing or bleeding after the puncture. So we need to be aware if they're on that. Alcohol, moderate amounts of alcohol usually don't affect test results, but except for, of course, an alcohol test. But glucose is slightly elevated, and chronic consumption can lead to increased values of liver function tests, okay, as well as platelet aggregation studies. So a large amount of alcohol or long-term alcoholism can affect other tests. Smoking increases things like cortisol, white blood cells, etc. It can even affect the hemoglobin, and it can decrease eosinophils. Smoking also affects arterial blood gases. Well, of course it would, because we're talking about what? Oxygen and carbon dioxide. Other things that can alter your test, stress. So we talked about like maybe an infant crying can actually alter the tests. So things like anxiety, crying, hyperventilation. So if they're blowing off that carbon dioxide or the oxygen, whatever, it might alter the tests. Different variations of the clock might change, like our body system, like hormones change throughout the day. Other things in our bodies change through the day. It might be more concentrated in the morning and less in the afternoon. Fasting. So prolonged fasting increases the bilirubin and fatty acids. A fasting specimen should be taken 8 to 12 hours after the last intake of food. It's the phlebotomist's responsibility to make sure that the patient has had no food during that time. Now, can you be 100% sure that somebody hasn't? No, but you can ask them and hopefully they're telling you the truth. Other things that can alter: caffeinated beverages like tea, soda, coffee, that kind of stuff has to be avoided. Caffeine can actually raise the blood sugar levels in your system. Age. So age can have different alters. The kidneys may not be working, the liver might not be working as well in an elderly person versus a younger patient. Altitude, I think we talked about that a while back, that altitude the levels, especially in things like oxygen and CO2, can be different. Red blood cells will be different in higher altitudes. Cholesterol and triglyceride values increase with age. But the sex hormones may rise and then fall also. Red blood cells and white blood cell values are higher in infants than in adults. So it's important that the patient's date of birth be documented on the form. Here's one that we might be involved in as far as this. Patients living in mountain areas have higher counts of red blood cells, hemoglobin, and hematocrit. So people maybe who live in the mountainous areas of West Virginia might have a little bit more of that. Dehydration, so if somebody's had prolonged diarrhea or vomiting, this can cause all sorts of different values, off. Sex, the normal ranges of analytes differ for males and females. Hemoconcentration produces a false increase in analytes, including the red blood cells, calcium, and sodium. Males, for example, have higher hemoglobin, hematocrit, and red blood cells than females. And of course, pregnancy. That changes a lot of different values. The presence of the fetus and increased water retention causes dilution effect and gives us like a false lower hemoglobin, red blood cell count. Okay, so all sorts of things can change our lab results. Okay, what does this say? I can't see it. Blood levels of which of the following often increase with age? Increase with age. Okay, I need one more answer out there. Cholesterol and triglycerides. So those increase with age, okay? Which of the following medications causes prolonged bleeding time? Okay, good. Aspirin. Aspirin thins the blood. All right, so sites. Sites that cause specimen contamination include hematomas. So that lady where she left the tourniquet on forever and ever and ever, and then came back, what, 10 minutes later? That specimen was contaminated before she even started. So that woman probably already had hematoma going. So also areas of edema. Okay, so the side of the body that a woman may have had a mastectomy, or for somebody who's receiving IV fluids on that side, the test may be altered. Okay. When a patient complains of stinging, pain, or tingling at or near the puncture site, you're going to stop the procedure. I don't think that phlebotomist stopped the procedure when she grimaced. The phlebotomist has almost complete control over the variables that arise during the specimen collection. So you guys have most of the, you can control what's going on as you're drawing, okay? Sites that can cause pain or injury to the patient include, like, you don't want to be, if you can avoid it at all, you don't want to be taking blood out of some area that has been burned or has bad scars or is constantly being punctured because of other draws or whatever, okay? The arm near the mastectomy, if you can avoid that side, go to the other side. Sites that have fistulas or shunts, again, try to avoid it if you can. And the back of the heel or other regions close to bones are not fun. So if we can avoid those. Accidentally puncturing an artery during a venous procedure or using an artery for routine collection carries a lot of risk. So we try to avoid that too. All right. So the tourniquet should be left on no longer than 1 minute, right? To reduce hemoconcentration. So if you're going to put the tourniquet on and you're going to look at the area to see where is a good vein, and then you find that vein, you take that tourniquet out, get everything ready, and then go back into putting that on. You don't leave that on and prepare and clean and wait and, you know, all that. You make sure that you limit the time that that tourniquet's on. Once blood flow is established, that tourniquet is released, not snapped like the video. Again, tourniquets that are applied too tight can cause that petechiae, which is all those little red dot spotting. Hemoconcentration causes false increases in large molecules such as protein and cholesterol. And the false decrease electrolytes, things like chloride and potassium. So we don't want to make it too tight or leave it on too long. Cleaning the area reduces the risk of infection, okay? She wiped the alcohol off, if you saw that. That was one of the things. So let's not do that. Blood culture collections require special care to prevent contamination. We learned that. And as part of a QA program, microbiology department keeps records of blood cultures contaminated with normal skin flora. All right, iodine must be removed from the site after collection. So if you are doing a blood draw and you've had to use iodine, you want to make sure after you're done, you clean it up. You don't leave it again like that lady left all that blood all over that poor woman's bed. That was terrible. Iodine can actually irritate the skin, so we don't want to leave that on. We don't want to use iodine for a dermal puncture. Iodine interferes with things like bilirubins, uric acids, and phosphorus tests. So it's not the cleansing. It's not what we want to use for cleansing. Specimen collection must be collected in the right tube for the test and in the right order, right? So we've been, every quiz or test we take, we keep doing the order. So hopefully that you guys will have that down when it's time for testing anyways. So we want to do it in the right tube and we want to do it in the right order. Sample volume must be matched to the quantity of the additive. So if the tube has an additive in it, you need to match the amount of blood in it, okay? Tube size should be chosen to provide adequate volume for the test. So if you have too small of a tube and you didn't get enough blood, it's not going to be viable. Labeling, be sure to label and make sure it's complete. You're going to label it right there in front of the patient, not before and not when you leave the room. You're going to do it once you draw all the blood. You're going to be labeling it. You're not going to turn your back on that patient. The specimen must be mixed gently and thoroughly by inversion right after the draw, which I don't think that lady did either. Label tubes immediately after they are drawn before leaving the patient's room, okay? Okay, so the patient's perception, what are they seeing in your skills and professionalism? As we watched in that other video, you know, there was a big difference between the carrying case, right? We had one that looked like somebody had vomited all that stuff. I mean, it was terrible. I mean, dirty things in there, it was cluttered. So your presentation is what that person, that patient is going to perceive you as either a professional or, ooh, I don't know if I want this guy or girl to do my phlebotomy, okay? So you want to make sure that you strive to avoid painful probing. We all want to strive for unsuccessful punctures, but it happens. But, you know, after one or two, then you should probably have somebody else help. You know, we don't want to be digging and we don't want to keep poking this poor person. The perception reflects not only on you, but on where you work, okay? We want to break the chain of infection by performing hand hygiene, which that lady did not do. And you want to wear your gloves, okay? And even if you're doing a glucometer, remember, you must wear gloves. In addition, infection control procedures must always be followed. You guys know that. All right, accidental puncture with a used needle. So it could happen. Must be reported immediately to the supervisor. So you stick yourself, because that lady recapped, she could have stuck herself. So she would have had a dirty needle. You need to report it right away to the supervisor. QA procedures include monitoring the number of accidental punctures and instituting what kind of training that institution needs, and if they need any additional equipment, etc. Okay, so not only are they wanting to make sure that you're okay, they want to make sure that we can reduce this from happening. All right, so immediate follow-up testing of bloodborne pathogens, and then there's counseling, and there's a whole procedure for needle sticks if it happens. Transportation, specimen transportation variables include the method of delivery, the treatment of the sample during transportation, and the time of delivery. We've talked a lot about this. Samples require either cold, warm during transport. They must be placed in appropriate containers, okay? So you might have that ice slurry, or you might have the, you know, something that needs, like the cold agglutinin test needs to be at 37 degrees Celsius, things like that. If something is got stat on it, that means that it must be delivered immediately on time, okay? Pneumatic tube systems require special monitoring to ensure that the sample is not overly agitated during the transport. This could cause the hemolysis, and some samples cannot travel by these tubes, okay? Just because they cannot be shaken up like that. So transportation is important. Separation times, we've talked about this. No more than 2 hours should elapse between the time a specimen is collected and the time that that serum or plasma is separating, okay? After this time, the sample will begin to show some false lowered glucose or elevated potassium, things like that. Ammonia samples must be separated within 15 minutes. The exception is for samples to be collected in a serum separator tube, which are stable once they are spun and good gel seal is in place. So that's an exception to this. Okay, so centrifuge maintenance. They must be calibrated every 3 months. Okay, so the centrifuge that we put these little tubes in, it has to be calibrated every 3 months so that we know that it's running at the right speed. Okay, Variation may indicate the need to replace worn parts. So if they keep getting different variants, the thing might be worn out. Spinning samples below the required speed may result in incomplete separation of the liquids. Heparin tubes can be centrifuged immediately after collection. So you don't have to wait on heparin tubes. So when we're talking about evaporation and contamination, specimens should not be left uncovered, okay? Evaporation of liquid, especially from small samples, can affect the ABGs, alcohol samples. So if they're left open, they can evaporate, and ammonia can also. Contamination may occur while the sample is uncovered. Things like dust in the air or talc from your gloves can get in there. So we want to make sure we keep it closed as much as possible. Contamination may also occur from incomplete separation. So when the red blood cells are left in the sample after incomplete centrifuge. Okay, so it didn't shake it up enough. Okay, so we have refrigerators and we have freezers. Fluctuations in cold storage units can degrade sample quality. Temperatures of refrigerators and freezers must be monitored daily, okay? So the centrifuge, every 3 months have to be calibrated. Temperatures of refrigerators and freezers have to be monitored daily and recorded. If they're too high or too low, this can indicate the unit needs maintenance or actually replaced. Aliquot handling and labeling. Specimens with different additives should never be combined in a single aliquot. Multiple prepared from a single specimen allow different departments to share a single sample for multiple tests. Each aliquot must be properly labeled as to the source and additive present. All right, so we already talked about analytic variables. Let's just talk a little bit more. An analytic variable is any variable that affects the testing process, right? So any variable that will affect the testing process. Although most samples are tested by medical laboratory scientists, medical technologists, and medical laboratory technologists, MLT, which is a laboratory personnel, the phlebotomist may be trained to perform these CLIA wave testings, okay? If pipetting of reagents is required for a test, improper pipetting techniques may yield results that fall outside the expected range or falsely, they might fall outside the ranges, is what more or less, okay? Point of care testing instruments, again, they require calibration and controls to be performed before testing patient samples. So we shouldn't run any test if the instrument is not working properly. And we're always going to follow the manufacturer guidelines for each point of care instrument. So there's so many out there. So to sit here and teach you about one, it depends on where you're at, and you might go on one floor and it might be different too. So you just need to know how to use the one that's at your facility. Post-analytic variable is any variable in the reporting and follow-up of a test result, okay? The phlebotomist, you may not be responsible, you may be responsible, but you may not also. Yours is more of a pre-analytic, but you might have some duties here. Before a result is reported, it must be interpreted as being valid, okay? So there's something that's called a delta check. This helps ensure that results are generated correctly. The method of delivery is determined by that facility, so it might include faxing, computer, telephone, hand delivery results, okay? There's something called a panic value. So it's a laboratory value well outside the designated range. This is called a panic value. So if it's way, way too high or way, way too low, this is called a panic value. How often should you, how often should centrifuges be calibrated? Okay. I believe that one was 3 months. Every 3 months. Very good. Good. Yep. So every 3 months. Okay. So that is what the PowerPoint. Okay. So let's move on. We're going to do one more thing today. Does anybody have any questions about that? I know it's really kind of boring stuff. Before I forget again, don't forget to send me that email. Even if you're available for just a slot of a few hours here and there, let me know those too, so that we can get you into that rotation. Mhm. Okay, so go ahead and pull up your Kahoot. We're going to play this just for review. All right, does everybody see the number? All right, let's begin. Good job, guys. Remember, you don't have any control of what that patient has done before they've come in. That's what patient prep means. Good job. Very good. Wow, we were split down 4 ways on that one. So cholesterol, remember that for older folks, it increases. One thing I'll suggest to you guys is to go over all of the analytic, pre-analytic, post, and the QC, QA, all that we did in the beginning. Just for review. So post, remember, post is after. So reporting and follow-up test results. That was on your quiz today. So is this one. Remember, glycolysis is glucose, guys. So aluminum foil will also protect from light. Good job. So the QNS, quantity not sufficient. Nice. Heparin right away. So bedside glucose testing is usually on what condition? Diabetes. Remember, that's wave level. That POCT is wave level. All right, guys, a lot of these are repeaters. Every day we check the refrigerator and the freezer. Every 3 months, the centrifuge must be calibrated. This one's a little tricky. Kind of think of the clock and how would you balance it? That would be a little bit more balanced. That's a little tricky question. Another quiz question. Alternate site testing is POCT. Pregnancy. HCG is pregnancy. Thirty to 45 minutes, good. We're going to do one more. Okay, so let's stop there. I wonder if I can do that. Oop. Don't know how to stop it. Oh, there, and quit. All right. So we made it to 50. That's one, that is the, let me stop the share here. Okay. Let me get that off there. Okay, so let's get back to us. Okay, so that is the one that you have to do, I think. Let's see, did we already do that one? That's the one due tomorrow, okay? So make sure you get that done. So that was a good practice for you to be able to get through that. Try to get those scores up, guys. A lot of those questions within that Kahoot are repetitive so that we get it kind of drilled into our brains here. All right, so send me an email of times that you'll be available, that you would have time to be able to do your rotation at the EKG site. Also on that email, indicate that if you have any interest in an employment opportunity with Parkersburg Cardiology, so that I know what to who to refer for that. What else? So on Thursday, we will do chapter 19. So coming up, you will have just your Kahoot, I believe. And not sure, are there mock, I haven't looked ahead here, but are there mock questions? Let's look here. What have we got going on here? All right, so we did the quiz. We have the Kahoot that's due tomorrow. Oh yeah, we have phlebotomy book exam, mock exam questions due on the 18th. And then another Kahoot that's due on Friday. Your test banks, start working on those. Don't wait to the last minute. They will be due next Tuesday, so don't wait to the last minute on that. And then you have module 7 to do this weekend. It's a little different. I think it's more simulation stuff. So we'll take a look at that on Thursday just to kind of go over it a little bit if you're not already working on that. So it's more simulation stuff, and that's the last module in the phlebotomy. So we're coming to an end of the phlebotomy. We have a mock exam coming up. So this is week 6, guys. We'll start reviewing for the mock exam probably on Thursday. We will have an exam on week 7 on Tuesday. We will have an exam on 16, 17, 18, and 19. That week we'll review for our phlebotomy final, which will be on week, I think our final is going to be on week, I think it's on week 8. I'm not sure yet. Yeah, so that'll be week 8. On week 7, we will do our very first phlebotomy mock exam. So we're coming to the end of this, and we're about to start EKGs. Again, send me the emails. Send me if you're interested at all in any kind of position at Parkersburg Cardiology after you graduate, or maybe they'll even take you before that. I don't know, probably. And I will see you guys Thursday. Does anybody have any questions? I know this one was a boring one. Oh, make sure you review all those little quotes. I would open up your book and go to the very first page of that chapter and look over those definitions of the QA, QC, et cetera, just so that you have those, because I do know that a lot of those are on your phlebotomy certification exam. Okay. All right, guys, we will see you later. Have a great day.